Okay, so let's try to talk about otosclerosis. Otosclerosis is usually a genetic disease. I mean, it runs in families. About 50% or 70% of patients with otosclerosis have family history. Otosclerosis is let's call it a remodeling disease of the bone in the usually ossicular chain, especially the stapes, especially the foot of the stapes, where is the oval window. There is usually remodeling of the bone in that area and creation of a new bone and hardening of the stapes to the oval window, which doesn't let the stapes move as it should, and therefore the propagation of sound wave from the ossicular chain, especially from the stapes to the cochlea, is damaged, and usually it causes this conductive hearing loss with a very special notch at 2000 Hertz, which is called the Cahard notch. So otosclerosis, this remodeling of the bone, hardening of the bone of the foot of the stapes usually cause this conductive hearing loss. It can also cause sensory neural hearing loss or mixed hearing loss, but more commonly the conductive hearing loss is more common. And there are theories why it can also cause sensory neural hearing loss, and I won't get into it, but the most prominent part of it is the conductive hearing loss, which is quite understandable because usually otosclerosis is at the foot of the stapes and doesn't let it resonance or move as it should, so it is understandable why it causes conduction problem, and therefore conductive hearing loss, as you expect with air-bone gap and everything that should be with conductive hearing loss. It can be unilateral, bilateral, and it can also cause, less commonly, vestibular disorder, vestibular pathologies like vertigo and disequilibrium, but it's less common than the hearing part of the disease. Now, the diagnosis is conductive hearing loss. You may see a audiogram that show this. The acoustic reflex is abnormal, and I think that it's quite hard, but you may also see involvement in imaging, for example in CT. Yeah. About management, one of the most common management options is just amplification. Sound aids or hearing aids are option for helping the patient. It's not curing anything, but it helps. And when it's not enough, surgery can be an option, and the main type of surgery is replacement of the stapes with prostate, stapedectomy and subtotal. Those are the main types of surgery that are used for otosclerosis when it is on the foot of the stapes on the oval window there, which is the most common area for otosclerosis. What else can I say? In ENG, there may be directional pepodenness or vestibular paresis to caloric stimulation. That it's another thing that we can think of when we're talking about otosclerosis. Those are the main things that I wanted to talk about in otosclerosis. Okay, and another thing is otosclerosis is a progressive disease. It gets worse with time, and it can also get worse in some situations like pregnancy. Estrogen can influence otosclerosis and get it worse, so in pregnancy it can get worse. So and it's more common in women. So women, pregnancy, those are the more at-risk patients for deterioration or worsening of the. Okay, in women it's more common, in pregnancy it gets worse. So those are the things that also should be noted. So otosclerosis, this remodeling, reabsorption of bone and then creation of new bone, can be in some places, mainly in the foot of the stapes where the oval window is. Usually conductive hearing loss can also cause sensory neural hearing loss, then mixed hearing loss. Problems with the acoustic reflex, ENG may show caloric absent or caloric damage, caloric stimulation absent, or directional prepondence. CT may show where is the disease, and the treatment may be conservative with hearing aids and or, when it's not enough, surgery for replacement of usually the stapes. It can get worse in pregnancy, and it's worsening disease with time, and usually the patient has family history of otosclerosis, very commonly because it can go in families. This is about otosclerosis. Thank you very much. If there are any mistakes or corrections, please tell me, and that's it.